Good morning, good evening, good afternoon around the world. Welcome and thank you for joining us for episode 7 of Endometriosis Explained. Ask the experts. Today we will be discussing Thoracic Endometriosis Syndrome. I am Dr. Camran Nezhat, the founder of the Worldwide Endo March, and joining me are the co-founders, Dr. Farr Nezhat, Dr. Ceana Nezhat, Dr. Azadeh Nezhat, Barbara Page, and also our expert for this session, Dr. Leah Backhus. Dr. Backhus is a known thoracic surgeon, surgical oncologist, thoracic specialist, and cardiothoracic surgeon that we are collaborating with for the treatment of our patients with endometriosis. Finally, we are joined today by our wonderful dear patients who are going to share their stories, Abbe Kopra, Jessica Schaffer, and Michelle Sundquist. We thank you very much for submitting your questions online. If you did not have a chance to do so, feel free to comment below with your questions, and we will try to answer them at the end of the session with Dr. Backhus. If you have missed any of our previous webinars and would like to rewatch them about endometriosis of the bowel, bladder, ureter, and infertility and endometriosis, pain and endometriosis, please visit our website at www.endomarch.org and click on webinars at the top. Worldwide Endo March is a registered 501c3 nonprofit organization that intends to raise awareness about endometriosis. It has more than 60 chapters around the world. All donations to this philanthropic organization are tax deductible. If you would like to continue to support the webinars and other events like this, please visit our website and click on the Donate Now button on the top right corner. If you haven't already downloaded the free Nezhat Endometriosis Advisor app from the Apple App Store or Google Play, and take the questionnaire to assess your risk of endometriosis, please go ahead and do so. Now, we will proceed first with Dr. Ceana Nezhat and Dr. Farr Nezhat that they mentioned some about endometriosis. Go ahead, please, Dr. Ceana Nezhat.
Good morning, good afternoon, and good evening, everyone. I am Ceana Nezhat from Atlanta, and I'd like to also thank you for joining us on this webinar. Considering all the participants, the variety, I'd like to just address a bit about diaphragmatic anatomy. It's a Greek word. Dia means apart and fragment means fence. And we look at it, it separates chest from the abdomen. It is very important to know the structure of the diaphragm, that it has 3 parts, and the texture of the diaphragm varies based on its location, the thinness, thickness, the relationship to the pericardium and phrenic nerve. These are the actual pictures of diaphragmatic endometriosis. that you can see on the left of your screen. You can see the thin part with the small lesions. On the right of your screen, you can see more of a typical fibrotic on the surface of the macularis. As I mentioned, the relationship to the phrenic nerve, also the vascularity, and the pericardium, it would affect the decision of how to treat these pathologies. These are the largest case series that's been reported. Of course, we have been reporting diaphragmatic endometriosis since early 90s. We have a large experience. But when you look at them, 80% of them are right-sided. In the other parts, they treat them with cardiothoracic surgery, video-assisted thoracoscopy. But in our centers, we have been able to treat majority of them transperitoneally and occasionally combine video laparoscopy and video thoracoscopic approach. This is a lesion that you can see the liver has adhered to the lower part of the diaphragm. This is a distal part of the diaphragm. And as we explore the lesion, you can see the chocolate-like material protruding. So the appearance is similar to the lesions involving the uterine wall, which is called adenomyosis, or ovarian cortex, which is called endometrioma. So it could have different manifestations. And you can see the endometrioma is removed, and you can see the base of it, which is more of a simple, normal macularis. This is one of the worst cases of the diffuse diaphragmatic endometriosis that I have done. And interestingly, she had 0 symptom when it comes to the area. So the treatment is decided based on the symptom of the patient and or if is structurally could causing any damage, for example, fenestration or phrenic nerve involvement. The next case that I'd like to share with you is the combination that we have taken care of it with video-assisted thoracoscopy. You can see the diffuse lesions, excised, and it can be either sutured or using the stapler that other colleagues would address that. The relationship of the diaphragm and the liver is very important. Specifically, the ligament suspends it and could obscure the view. So at times, it's important to free these ligaments to have a better access to the deeper part of the diaphragm. This is the diaphragm here on the top. You can see this is a lesion, that this lesion is adhered to the diaphragmatic part, pulling the liver out. In the past, they used to diagnose this as a Fitzhugh-Curtis syndrome, or probably they thought it may be related to the PID, but actually this is a liver lesion that, if you see it here, penetrating deeply into the wall of the liver, creating an endometrioma like that I mentioned. You can see it in actually
the lesion is elevated
here
and
on the
excision is
liver.
performed with the CO2 laser.
So this is a video one of my fellows presented
during this process.
About 20 years ago.
A loculation is then visualized from which the material was released. Excision is completed with the CO2 laser using the suction irrigator as a backstop. Final pathology confirmed endometriosis of the liver.
So the reason I did share this with you, because unfortunately on the internet, they are mixing the instrumentation with the treatment. I heard one of my patients was telling me, oh, using laser on endometriosis is bad because on internet they say whoever is using endometriosis is not excising endometriosis. Well, clearly you cannot write off a device because this person who doesn't know about that energy source would misinform the other patient. Laser, scissors, harmonic, monopolar, these are all tools. It's not the vehicle that gets you there. It's the goal, the treatment, and the destination. So this is a lesion precisely excised from the surface of the liver, separated from the diaphragm with the laser that you saw. So on that line, I will stop here. And Dr. Farr Nezhat will share with you diaphragmatic endometriosis surgical management. Thank you.
Thank you, Dr. Farr Nezhat. Now, Dr. Ceana Nezhat. Now, this is Dr. Farr Nezhat would demonstrate for you one case of endometriosis which involves diaphragm and also the pleura of the chest.
Good morning, good afternoon, and good evening, wherever you are. It is a pleasure to be here. So this is a young woman that had history of the endometriosis for several years. She was only 24 when she came to us, and she had I'm sorry, how come? Can you see the sharing, Camran?
Yes, I'm sure Tiffany is, yeah, perfect. We see your picture. Yes, excellent.
She had had 2 prior surgeries. She had had numerous lung collapse, and she had had pleurodesis, and she had been on Dipolupron for 2 years, and still she had chest pain on her left side, pelvic pain, and whenever she was stopping her hormonal suppressive therapy, she was having pneumothorax. So now we are doing robotic assisted laparoscopic treatment of her pelvic endometriosis and adhesions, diaphragmatic treatment of endometriosis, and our thoracic surgeon takes care of her left chest. Now, this is inside of the abdomen. Now you see she has severe adhesions between the loops of the bowel from her previous surgeries. And here you could see we are using the robotic approach. This is a diaphragm. This is the liver, as Dr. Ceana Nezhat showed you. And you could see the liver is attached to the diaphragm, and there are several holes on the diaphragm that had made part of the liver penetrates to the chest. So this is the diaphragm here. You could see endometriosis down here. And here you could see the holes here. And here you could see this part of the liver has endometriosis. This is again robotic approach. And that is the area of endometriosis of the liver, which is going to be excised. Dr. Ceana Nezhat showed you excision with CO2 laser. Now we are using electrosurgical scissors for excision. And further, certain area which has some small bleeding, we are going to coagulate them. You don't want to damage the liver a lot. You don't want to excise everything to damage the liver. Here you could see you could coagulate or vaporize. And here you separate the liver further from the diaphragm. These types of the procedure needs a lot of skills in surgery in the upper abdomen. I am a gynecological oncologist, and we take care of cancer of the diaphragm all the time. Now we are looking inside of the chest through the abdomen. You could see this is the liver, and this patient had prior pleurodesis. They have put talc powder in the chest to prevent pneumothorax, but didn't work. Now you are lysing the scar tissue here further. This is the part of the bowel. You have to be very careful. And it's the liver, immobilize it. Now, all of these holes has to be closed. You check the left side, and the left side it is fine. Now, because we want to cover all of these holes, so we put a mesh to cover all of these holes and prevent the future pneumothorax and collapse of the lung. So here we put the mesh and suture it, the mesh to the diaphragm. The robotic platform makes this procedure easier, although we can do it by laparoscopy too, but the robot makes the suturing easier for the surgeon. And here you can see that part, it is done. So we have taken care of the chest. Now you can see she has severe adhesion between her bowel to get to her pelvis. You can see here, everything is glued together. This is the uterus, the bowel. She had endometriosis of the bowel here. This is the left ovary. And all this endometriosis has to be taken care of. This is the right side, this is the left side, and we took care of all of the endometriosis. You could see everything is free. Now our thoracic surgeon takes over. And now the thoracic surgeon looks on the left side of the chest. And you saw there was blood, bloody fluid on the chest because of the endometriosis. And this is adhesions here that he is going to lyse it to cut down the scar tissue. This is the lung, and the heart is below that. You could see the pulsation of the heart. And this is the pleura. You could see endometriosis on the pleura, and he is excising all this area of endometriosis from the chest wall. Again, this is electrosurgery, that it is going to be excise all these areas from the pleura. This is, again, collaboration between different disciplines to be able to give the best benefit to the patient. You could see the pulsation of the heart moving the, this is the heart down here. You could see the entire area of the pleura has been excised. And the procedure although was lengthy, but patient did very well. We put a chest tube, and she had significant improvement of her pain. Thank you.
Thank you very much, Dr. Farr Nezhat, for your presentation. That was excellent. The same thing for Dr. Ceana Nezhat. Thank you for your excellent presentation. Now we proceed with our dear patient, and Dr. Azadeh Nezhat is going to introduce Jessica Schaffer and also Abbe Kopra. Go ahead, Dr. Aziz. Hello? Okay, if Dr. Azadeh Nezhat is not available, let's go ahead.
I
So
think she's just muted. She's muted.
Proceed, please.
okay, why don't we proceed with Jessica? Jessica is, I let her tell her story, and after Jessica, we will proceed with Abbe. We thank both of them very, very much for being willing to share their story to help other patients and raise awareness about endometriosis. Jessica, please proceed.
Hi, everyone. Okay, so growing up, I had completely normal periods, and it wasn't until I got the Nexplanon birth control implanted that a month later I had a cyst growing on my right ovary, and I went into surgery and had it removed. And after that, my periods were never the same again. And since I had experienced what a period's supposed to be like, I definitely knew there was something going on. And I continued to go to doctor after doctor and just kept being told all your lab work was coming back normal, everything checked out. Nobody could figure out what was going on, why cysts kept on reoccurring. And I started to have debilitating cramps. And at one point, I was even told that I don't have endometriosis. And like so many others, I was unaware of what endometriosis even was. So, you know, doctor told me I didn't have it. And of course, I believed that and just went forward and continued on trying to find answers. And it wasn't until last year that I finally went back to Houston, and I had a primary physician there that I had gone to years ago. And when I went in with her, within minutes of me telling her what I had been going through the last 5-6 years, she immediately was asked about endometriosis. And I told her, well, no, they told me I didn't have it. And she said, well, how were you diagnosed with it? And I said, well, they did a pelvic exam and an ultrasound, and that was everything that took place in that appointment. And she's like, she immediately referred me to an OBGYN that got me in and explained to me that the only accurate way to get a diagnosis is through surgery. And at that point, when he did the ultrasound, I had already had another cyst on my ovary. So he was already going to plan to take that cyst out. And he said that whenever he was doing that, he would go through and just check and see if he could find any endometriosis. And again, since I was so unaware, I didn't know that, you know, ablation versus excision, I didn't know that. And for this doctor, he only knew ablation. And so that first surgery, that was March of last year, he went through and burned everything off. And, you know, I always thought, I was like, once I finally have a name to what's going on, I thought, you know, I'd have all these answers and would find relief. And instead, I got the diagnosis, and it only went downhill from there after that ablation. It was basically like fuel to the fire. I had started, the pain was getting worse. I had more symptoms increasing. They were just, everything kept piling on. And that was when he referred me to an endometriosis specialist. And eventually I realized it wasn't a specialist. He was just a fertility specialist who took a couple lectures in endometriosis and then claimed that, hey, I know endometriosis. So what he did was put me on multiple hormone medications and It wasn't until it was my fourth hormone med that he prescribed me, or actually it was my fifth one. And then the pharmacist pulled me aside and she asked me, she's like, what's going on? The dose, I've never even had anybody prescribe such a high dose, as well as I was on 2 birth control pills, 2 different types. I was on the Mirena. They were trying anything and everything to get my period to stop, and it wouldn't stop. Sometimes it would even go on for months at a time. And so he was trying to get it to stop and it wouldn't. And whenever she kind of brought it up to me that it was a red flag, I was like, okay. So I put my foot down. I was like, no more being a lab rat. I'm not gonna just continue taking all these meds that I don't even really understand what's it doing, because I didn't find any relief. So I decided to go see another doctor, and during that time, it had gotten to the point where I ended up on medical leave, because I would get these cramps that were so sharp that it would cause me to stop breathing. And then once I stopped breathing, my vision would get black. And right before I fully passed out, I would come back to, I could get my breath and I'd be okay. But this went on for a month straight, multiple times a day. So I couldn't drive anymore, because if it happened when I was driving, that could end up in a bad wreck. And then I was also a liability at work if, once I did have a fainting spell at work. So then, they were like, I'm fortunate enough that my boss was so understanding, and he said, you go and take care of yourself first. Once you're back and healthy, you can come back. And so after that, I had found a specialist that could excise all my endometriosis. And then once again, I was back in the OR, and that time when I woke up from surgery, I had been hospitalized and found out that during surgery, my median sacral artery was nicked, and it was centimeters away from my aorta. So I was very fortunate to even make it off the operating table. But when I came back to it, the doctor actually blamed me for it. He goes, your size, you're just so small that, I nicked it because of your size. And I was like, okay, well, and that was, after that, I was then considered high risk. I no longer went to that doctor. I waited a year to get in with a specialist that had patients fly in from all over the world. And so the wait list was extreme. So, I waited that year. And when I got in with him finally, it was almost $2,000 that I had spent to even see him. And he sat me down and he said that I was high risk, that he couldn't help. And he's the one that referred me to Dr. Camran. And at that point, though, I was pretty devastated. I'd spent all this time getting passed from one doctor to the next, and I just felt like that I was never going to get any help, that, I kept being told that yours is too severe. And so, it's hard to definitely, go through that. And the moment that I walked into Dr. Camran's office, I knew right away that I had finally found the place that I was supposed to be at. Before he sees you, he has you download his app, and it has a questionnaire that you fill out. And during that questionnaire, there was a question that said, do you have right shoulder pain? And I had had that for years. So when I actually sat down with him, I was like, hey, I've never had another doctor even bring this up. Why is that a question? And that's when he explained to me that endometriosis can grow on your diaphragm. And so I brought up, I said, hey, I get out of breath just walking up a flight of stairs, and, I get shortness of breath where I have to take a huge deep breath to even feel like I can fully breathe. So I was like, is that also a factor for any of this? And, he said, we sat down, I had a long list of questions. He went through every single one of my questions. And at the end of it, we agreed that, for me, the best option was to once again go through surgery. And during that surgery, once I woke up, the first thing he said to me whenever well, that I can remember once after anesthesia and everything, he said, you know, none of this was in your head. You know, I did find the endometriosis in your diaphragm. And that surgery was last month. The pain in my right shoulder is significantly better. I mean, there's still like a mild little bit, and I think that's probably residual that I think in the time it'll probably go away. And for now, you know, we have a plan of how we're gonna handle everything going further. And I finally found somebody that's listening and that actually helped for once. And so with endometriosis, and for me, I have stage 4. I am aware that it can grow back, but knowing that I finally have somebody that I know that I can call and count on to help me through it all, it just changes everything for you. So that's why I'm here doing this. I was so unaware, even within that year of like last year of being diagnosed to now, all my research that I had done and my family had done. I mean, we were reading books, we were reading medical journals, you know, everything possible. And I had never even seen diaphragmatic endometriosis until he brought it up. And it just, I just want to do as much as I can to help the next person so that hopefully they don't have to go through all these years of not knowing and not understanding. And I do believe that if you do catch it in time, you can prevent it from progressing to this extent that I am at now. I think if anyone wants to reach out, I can give her my information. If you guys want to talk, I'm always here. I've experienced it all with you guys. So if you guys ever need any kind of help or support, definitely let me know. And thank you for allowing me to share my story. And thank you, Dr. Camran. You gave me my life back. You know, like it's great to finally have that back. So thank you.
Thank you very, very much, Jessica, for sharing your story. And that is the purpose of the Worldwide Endo March, is to raise awareness. All the physicians that you have seen, all of them are good. All the physicians, they like to help people. They have good intentions. They want to help. The issue is what the mind doesn't know, eyes don't see. That is why endometriosis is an enigmatic condition. It is underdiagnosed and misunderstood. That is why your story that you are sharing, we are very thankful. We are raising awareness everywhere, more and more, due to the efforts of Worldwide Endo March across the world for the past 7 years. Because of patients like you and because of the Worldwide Endo March, people are getting help, and it's going to get better. Now, I don't know if Michelle Sundquist is available, Dashtina. If she is, she can go first. If she is not, we will let another patient of ours, Abbe Kopra, to present. Is Michelle available?
No, Michelle would like to wait a little bit, go later. So you go ahead, please.
Okay, now we have another patient of ours that we are grateful to her, and she has a very fascinating story. And Abbe, please share your story, and the journey with endometriosis.
Okay. Good morning, everybody. Thank you, Dr. Nezhat, and to the whole team for this event and for inviting me here. I want to share a little bit about my story. It's interesting. I think I'm maybe a little bit opposite to the last story in that I grew up with classic endometriosis symptoms, pain so severe that I would black out in my bathroom, just, bleeding and unable to walk. And my solution to that was to take hormonal birth control consistently for about 15 years so that I didn't even have periods, because who has time for that when you're trying to build a career and build a life for yourself? That stopped when I was 32 and my husband and I wanted to get pregnant. And that's when we realized just how extensive my endometriosis was. So I do have stage 4, and I've been battling a sort of multi-systemic endometriosis over the past 3 years. I've had 6 major surgeries and a lot of minor procedures, things like kidney stents. And to be honest, at the beginning, the lung endometriosis, when we first figured that out, was perhaps the least worrisome to me, because I was in this repeated battle to try to save my reproductive organs, to save my kidneys, which Dr. Nezhat worked very hard to do, and we were successful. But I have a type of endometriosis that's extremely recurrent. It kept growing back and I needed additional emergency surgeries. The first time that I realized something might be off with my lungs was actually when I did a round of in vitro fertilization. I'd had my fallopian tubes removed. They were damaged from endometriosis. And as I was going through the medications, I noticed a distinct kind of crackle and cough in my chest. And I thought, how odd. I actually wound up going to see my primary care physician about it, who didn't know what was going on. When I finally figured it out, it was a few months later when I had that same symptom, along with a high fever and a cough, which occurred right after a surgery. And so I was hospitalized, and they did a X-ray, and I was diagnosed with my first official pneumothorax. It was a small one, a small lung collapse, a small piece, which at that point was able to resolve on its own. I continued to have small kind of spontaneous pneumothoraces over the coming years. And they were manageable in that they could ultimately resolve on their own. I got to understand sort of what it felt like to have a small piece of your lung collapse, do a lot of deep breathing to get it kind of back in place. And then eventually, after a lot of very severe and recurrent symptoms, I wound up having a hysterectomy. And I was thinking at the time that might also help with the lung situation, because I was on strong suppressive medication. I'd had a hysterectomy, and I felt like maybe that would also help with the lungs. I found out that wasn't true in a pretty dramatic way. I had flown around the world to visit my husband's family, and after a very long plane trip, which I learned later can be a trigger, about 50% of my lung collapsed. And so when we returned from that trip, I had immediate surgery to fix the lung. My case, again, recurrent and a little odd, but although the surgery was very successful, they found endometriosis on the diaphragm and the lung, were able to remove those pieces and do a pleurodesis. I had additional symptoms a few months later, and even though it was pretty unlikely, we got a scan and found that it looked like the collapsing was continuing. So we did do another surgery to fix that. I will say that was the last of my surgeries, and I feel incredibly grateful to the amazing team that I've found working with Dr. Nezhat, Dr. Backhus. I mean, after an extensive period of time and a ridiculous amount of pain, as many people will understand, again, I feel just truly that I have my life and my health back in my hands. So.
Thank you very much, Abbe, as always, for sharing your story and helping other people to understand about this enigmatic disease. And now we are going to go to Dr. Leah Backhus, your doctor. And thank you all of you who have submitted your questions. And Dr. Backhus is going to address all the questions that have been submitted. Dr. Backhus is a cardiothoracic surgeon and a specialist for malignancy, cancer, and we have been privileged to work with her, with our patient with endometriosis of the Thoracic Endometriosis Syndrome. Leah? Unmute yourself, Leah.
Thank you, Cameron. What a really nice introduction, and thanks for the invitation to come and participate in this webinar. I am happy to answer the questions that have been already pre-submitted, or any other questions that may come up in the chat. Do I need to pull up the questions, or
Yeah,
do you
go
have
ahead and
them?
you use, yes, you have all the questions you have received.
Okay, I don't have them right this moment, although I did review them. I will pull them up. Sorry, this was not a part of the prep.
No problem. If you don't have it, this is very easy for us to bring
I
up
do.
the
I've got
question.
it now.
Yeah.
Yeah. Okay. So the first question has kind of already been answered, I think, very eloquently by our patients. And that question is, what are the symptoms and signs of endometriosis of the diaphragm and the lungs? I'll just try to reiterate what was already said. The main symptoms are pain or pneumothorax, which is collapse of the lung, or sometimes hemothorax. And the pain is the one that probably varies the most, in that it can be, it's usually a sharp pain rather than dull pain. And you can have referred pain, such that if it's specifically the diaphragm that's the most involved within the chest, then you can have, because of the way that the nerves are in proximity to one another, the perception of pain on the diaphragm is referred to the shoulder. So you can certainly have patients presenting with shoulder pain who've had extensive workups of their shoulder pain without anything being found. That can also be a symptom of endometriosis. So those are the main three: pain, lung collapse, and hemothorax. The next question was, does every patient need a thoracoscopy? I think that's a really good question. It's so, I mean, I think the short answer is no, but much like the abdomen or the pelvis, if you truly are trying to confirm the presence of endometriosis or not definitively so, then yes, you do need that. I think the difference though with the chest is that any patient that I'm operating on has already had at least one, if not several, prior surgeries in the abdomen. And so the diaphragm is a really interesting organ, if you will, because it's a double layered muscle. And so you can have endometriosis on either the abdomen side of the diaphragm or up above on the chest side of the diaphragm. And if you see endometriosis on that abdominal side, then certainly I'm much more suspicious that there could be endometriosis on the other side. But you can have it only on one side versus the other. So if you've had a laparoscopy that confirms presence of endometriosis on the diaphragm, then that definitely, and you have chest related symptoms, then that's highly suspicious that it would be present. And those are usually the patients that I see referred from Dr. Nezhat. Feel free to stop me at any point here, Dr. Nezhat.
No, please. No, this is the podium is yours. Please answer all the questions, because people are very interested and are watching. Answer all the questions, please.
Okay, great. The next question is, can you have thoracic endometriosis and not have a period? I think that's a good question. It may actually be better answered by you, Dr. Nezhat. I mean, you can certainly have endometriosis, and it may not be, it can be somewhat quiescent. It can sort of just depend upon if you're under hormonal suppression at the time or not, whether or not you have endogenous estrogen production at the time, et cetera. So you can absolutely still have the endometriosis. Whether or not it's symptomatic is a separate issue. It just depends on where you are in your treatment of the primary endometriosis. Did you want to add anything to that at all?
Yes, I agree with Dr. Bacchus. Endometriosis, as I said, it is a very enigmatic disease. Actually, we have reported one case, and not that specific case. This is part of the case series that Leah, we did it with the previous thoracic surgeon. He was at Stanford, Dr. Ramin Beigui, that she had history of hysterectomy and bilateral salpingo oophorectomy, and she was on hormonal suppressive therapy, and she ended up having endometriosis of the lungs, and so we had to resect it. So you are correct. It could happen.
Okay. The next question is, can endometriosis be found in the nasal passages or airway? If so, what are the symptoms patients should be aware of and how is it diagnosed? I personally have never seen endometriosis in the nasal passages, so I'm unaware of that one, but within the airway, like the trachea, the bronchi, etc., like in the tissue of the lung, yes, you can. It's incredibly uncommon, but it's certainly a potential there. And at the time of surgery in the chest, I always do a bronchoscopy specifically to look for that. The way that it would otherwise present in a patient is that they would have blood-tinged sputum, or they're coughing up blood. And again, that would be periodic, and it may not be frank blood. In fact, it probably won't be. It'll be kind of that same chocolatey sort of old blood look, the kind of rust-colored, deep brownish red. And it may or may not accompany your other endometriosis symptoms. Again, it will depend upon whether or not you're being hormonally suppressed at the time. So it's possible. It's incredibly uncommon, but it's something that I look for, which is very easy to do at the time of any chest exploration via bronchoscopy.
I agree with Dr. Bacchus, again, that this is very rare, but endometriosis of the mucosa of the nose has been reported, and we have seen also one case of in our own practice. So it is possible, but extremely rare.
It's one of those things that, like, it can be anywhere.
That's right.
As you said, very enigmatic. Let's see. The next question is, I have pelvic and thoracic endometriosis. I've had lung collapses with both lungs. I'll be 38 years old this month. Is it possible to still think about having a baby? I'm currently taking CBD and THC oil and Visan, and it helps, but I would like to have a baby. Is that still possible? I mean, I think that that's much more of a question for you, Dr. Nezhat.
Yes. First of all, definitely your condition is possible. I want to let everybody know, all the people who are watching, all the people who have submitted the questions, we are not treating you here. We only as a general rule, we are answering these questions. Every one of you has to be seen by a specialist to be evaluated. Everything that we say here, and we are answering your questions, we are not an advice, and it is not a treatment for you. You have to see and to be examined by us or by your physician, then we make the final decision. This is only suggestions as guidelines. But the answer to the last question, yes, definitely it is possible for you to get pregnant. And thank you. Leah, please continue.
Sure. I can jump over to the chat here. There's a question specifically for Dr. Ceana and Dr. Farr, but I can also address it here too. It says, is it possible to have thoracic endometriosis and not have a lung collapse? I mean, the short answer is yes, absolutely. So you can have totally asymptomatic endometriosis in the chest to severely symptomatic and everything in between. But I'll defer to Dr. Ceana.
Well, hello. Yes, these are all fantastic questions. As I mentioned, and I showed you actually one of my severe cases that it was incidental finding. You could have endometriosis without symptom specifically on the diaphragm, It depends on the location of it and how it would affect the structural abnormality. But patients could have endometriosis of the pleural, like you saw, and they don't get the lung collapse, but they could have shoulder pain, chest pain. Actually, it would bring us, if you don't mind, I can go ahead and introduce our third patient, who I'm grateful for her to volunteer to share her story. Mrs. Michelle Sundquist, that you will be amazed to hear her story, and I am impressed because of the educated patients. You heard the stories of, unfortunately, due to the lack of awareness, some of the healthcare providers may underestimate the endometriosis. So Michelle was the person who educated herself, and Michelle has little Ceana with her. Welcome, Michelle. I will stop talking and let the people judge for themselves that how educated patients could take control of their health.
First of all, I want to tell you, Dr. Nezhat, it is an extreme honor to be able to do this. I'm actually overcome with excitement and emotion. You guys, every participant out there is looking at little Ceana. I named my daughter after Nezhat, and this is going to be the most unbelievable story. Till this day, Ceana is 6 years old. Ceana, if you want to look up and say hi. She has been the biggest blessing. And I got on when I heard the 38-year-old talking to Dr. Backhus about how she's 38 years old and have 2 lung collapses. Well, I'm going to tell you this, and I hope you're listening. Don't let anybody tell you it's not possible to have children, because my story was what you would consider impossible. And by the grace of God and by the hands of Dr. Nezhat, I have 3 biological children I'm going to tell you about. So let me share my story. Back when I was in my 20s, and actually when I started my period, I was around 12 years old. And I will never forget my first period. I was in a lot of pain. I didn't know what was going on. I am Middle Eastern, so my family was not one to really talk about these kinds of subjects. So I kind of just discovered it, and I remember the teacher had to send me home, and then my mom realized, wow, it was her period, and she can tell I was in a lot of pain. And I had had a lot of pain since that age, but managed it with Tylenol, but as I got older, got more severe. When I was in my 20s and I had just started my new job, the pain seemed to have gotten worse and worse, and the pain started to become associated with violent vomiting, but I never really put that my period and my vomiting, it didn't seem like the two would go hand in hand. So one day I had to go to the hospital. The pain was so excruciating. I vomited so much, and that's when I was admitted for surgery. I think they did a scan first and realized that I had a bowel obstruction. When the pathology came back, they noticed that I had a bowel obstruction from endometriosis. I was around 27 at the time, and I realized that, oh my goodness, that's how bad my period was. That's how bad endometriosis could be. Then shortly thereafter, I had gotten married, and my husband and I started to try to have children. And I guess in the back of my mind, I kind of knew that I was going to be in a lot of, I guess I knew it was going to be difficult just based on how much pain I was in and the surgeries that I had to go through, namely the bowel obstruction. So I had a bowel resection. Well, I decided somebody referred me to a doctor, just from a girl that I heard, to a doctor in Atlanta. But then when I told my OBGYN here that I'm going to this doctor in Atlanta, would he give me the referral? He goes, wait a second, I'm going to refer you to somebody better. It happened to be a doctor in Atlanta. He says, no, I don't want you to see this doctor in Atlanta. I want you to see a man named Ceana Nezhat. And he looked at me and he said, this is the doctor that every OBGYN goes and sees. And he says, don't go to anyone else but him. He goes, I've learned under him, and all my brothers learned under him. So I was so happy. The first time I met Dr. Nezhat, I just loved him. My husband and I were so comfortable. And he had to do the first surgery, which was about 5.5 hours long. And he can tell you there was a lot of endometriosis. But then he gave me his blessing to go ahead and do IVF, because he says now everything is clean, all the endometriosis is off your ovaries. But because I'm going to tell you, it was everywhere. It was in my uterus, my lack of a better term, my buttocks area. I mean, it was everywhere. So then my husband and I proceeded to do IVF, and I got very blessed on the first time. We had a beautiful little boy who's not here. They went to go play tennis, and that was such a blessing. And that was great. Then I wanted another child, obviously. And the older I got, the harder it became. But I went every time I did an IVF. So I had done like 5 IVFs, and I kept failing after I had my son, Jack. And of course, what did I have to do? It was time to go see Dr. Nezhat, the one and only human being that I trusted with my body. And let me say this again, these men are literally the best of the best. I will put my hand on the Bible and swear to it. Then again, Dr. Nezhat, when I wanted my second child, did my second surgery. And everybody used to say, well, you shouldn't have any more endometriosis after you have had your first child. Well, I know now that is not true. He did his endoscopic surgery. And, well, I'm sorry, I'm not telling you the full story. Between my first son and my second son, Evan, I had 12 failed IVFs. And when I went back to do a second procedure, 12 failed IVFs. When I went back, lo and behold, when Dr. Nezhat goes in, cleans me out, I had my second child. None of the reproductive oncologists could believe I had a second biological child, because let me tell you, that follicle stimulating hormone test kept saying I have no eggs in my ovaries. But I'm about to tell you the most unbelievable part of this story. I really wanted a little girl. I wanted a girl more than anything. And I begged and begged my husband to please, let's go through this one more time. Now, I am not gonna lie to you, I hated IVF. By the 14th round, my body is just so fatigued from these forced hormones. And I almost didn't want to do that, but I went to have one more surgery with Dr. Nezhat, and these were his last words to me. And these words will forever be cemented in my head. He goes, Michelle, I got a woman naturally pregnant at age 47, and I have C in your ovaries. There are eggs still in your ovaries, and I don't see any reason why you can't have another child. Well, anyway, we go back, and I decided, hey, I'm just going to do everything as holistically as possible, along with the IVF. But in the meantime, I'm still going to try, have to get my cycles right. And I was working with a doctor in California. And then finally, I just ate better, listened to the advice of my acupuncturist. And on the day that the IVF medicines arrived for the last and final round, because if it failed, then I'm out of luck. This was it for me. I was feeling really sick. I mean, my husband was making hamburgers, and I was like, this is just terrible. And he goes, Michelle, just take a pregnancy test just to see. I said, it's going to be negative. I was like, let's not even waste our time. Well, he just goes out and buys one. No, I'm sorry. We happened to have one at home. And I said, just go ahead and tell me it's nothing. He goes, it must not be working because it says pregnant. It's flashing pregnant. I was like, what? Yeah, he said he thought it was broken. So of course we were shaking. He ran to Walgreens and bought 5 more tests. Pregnant, 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 and with 5 weeks plus. Of course, I called my acupuncturist. I called the doctor, and the doctor says, come and let's see. The next day, there it was in my uterus, a beating heart, a little tiny beating heart. You guys have to understand, every doctor said I could never conceive naturally except for Dr. Nezhat. Even though Dr. Nezhat was very supportive with IVF, I hanged on so dearly to those words. It was the day that the 14th box of in vitro medicines came, and there I was carrying a little baby. So I go to the maternal medicine. I had to get a maternal fetal because I was considered a senior citizen. I think I was 39 years old. And they kept saying, do you want to know what it is? And I'm crying. I'm like, oh, I just don't want God to think I'm ungrateful. Maybe I shouldn't know. I shouldn't know what it is, because God has already blessed me with 2 beautiful children. And the lady kept saying to me, are you sure you don't want to know what it is? I'm like, but I was so engulfed in my emotions, I didn't realize what she was trying to say. And I guess my husband looked at me and said, for God's sakes, let's just find out. I think I was at this time 20 weeks, and we opened up the results, and there it was, a little girl. I went crazy. I even fell on my knees. I called Dr. Nezhat immediately, but before I called him, I wanted to look at the meaning of his name. I pulled it up on my phone, and it came up, Ceana, C-E-A-N-A, came up. The meaning was, God is gracious. And I called Dr. Nezhat, and I said, Dr. Nezhat, we are having a girl. I got pregnant naturally, and I'm naming this child in honor of you. And today, Ceana, look up and say hi. Hi. This child, this miracle baby, when every doctor, except for Dr. Nezhat, who so believed in me, believed in my cause, allowed me to have this child. When I went to the reproductive endocrinologist who told me that I'll never have my own child, he could not say anything. He threw up his papers in the air and said, it just goes to show God is the ultimate, and he's in control. And I'm here to tell you, make an appointment with one of these Nezhat brothers, or it's Dr. Leah, because I'm telling you, it is worth going to the best of the best. And my endometriosis didn't stop after my daughter. For the person on the phone who had the lung collapse, this lovely 38-year-old, well, after Ceana, when Ceana was a year old, my endometriosis came back with such a vengeance. I ended up having 4 lung collapses, 4. And when I was in the hospital with the first one, and I called Dr. Nezhat, as I always do, he said, you know what? I bet it has to do with your endometriosis. I'm sitting here today, pretty free of my endometriosis, because I've done everything Dr. Nezhat told me to do. Yes, I had my 3 children. Yes, I had to go into early menopause, but I would do it again. I would absolutely see one of the Nezhat brothers. I would say listen intently to their advice, because I am sitting here with 3 miracles, and I'm a firm believer. And anybody is free to reach out to me, because my story is unbelievable. And I'm happy to say it is possible. It is very possible. Thank you.
Thank you very, very much, Michelle, and also beautiful, beautiful Ceana for joining. And the Ceana looks fantastic, and also she looks awesome because of the Halloween.
Yeah.
I really like your Halloween costume. And thank you for sharing your very, very wonderful, inspiring story and raising awareness about this. And we truly, truly appreciate your kindness, and we congratulate you and Ceana, also my brother, to be part of your life. And congratulations.
Thanks.
So
Can I briefly add one more thing, that Michelle, after 3 lung collapses she had, one of the audience had asked that could you have lung collapse without lung endometriosis? Yeah, Michelle did. And she had to do she had diaphragmatic fenestration that we took care of it. And I am pleased to tell you, since her last surgery, thank God she's been symptom-free. Am I correct?
I have been the happiest I've ever been, completely symptom-free, like a new person. Yes, I am the happiest. This is why I want to tell your people, don't go shopping around for doctors. You're seeing the best here on the panel. It's worth flying out. I had to travel almost 4 hours every time to see them. I don't regret it for 1 minute.
Thank you very much, Michelle. Thank you, Ceana, for joining us. Happy Halloweens.
Yeah. Bye.
Bye.
well, thank you very much again, Michelle and Ceana, and also our other panel. What we have to say is, all I want to say again, all the physicians, all the doctors are very good. They have good intentions. They want to do help. The issue is the problem with endometriosis, which is enigmatic. That is why the purpose of this series is to raise awareness among everyone, and thank goodness we are making progress. We want to mention to you that we thank you very, very much for joining us. You will not be having, or we are not going to be having any sessions for the remainder of the year. That means for the November and December. We wish you a safe and happy holiday season. Join us in January, where we will kick off the year with a session on endometriosis on teenagers. And the reason that because of the November and December is going to be holiday season, everybody is going to be busy. You can continue to see the previous webinars if you would like, and visit them on endometriosis or Endomarch, www.endomarch.org. If you go there and click on the webinars at the top, then you can see the previous session. What we are doing here is we are not telling you any medical advice, except that you have to see a physician who's an expert, and then they would give you opinion. See any physician that who's an endometriosis expert. If you are around Atlanta, New York, or here, we would be happy to see you, and it would be a pleasure. We would like to thank all of the participants, especially Dr. Backhus, Michelle, Abbe, Jessica, Dr. Jackman, and Dr. Agrawal, who have been online, our fellows who have been answering questions, Barbara Page, Zoe Pennington, Tiffany Letowski, Sean Stetner, and Lily Kopra. You all have been fantastic, have been great. Wishing you a great holiday season, and we will see you in January. Bye-bye.
Camran, do you mind? One question somebody asked on the chat, I answer. Just quick question.
Please go ahead, please.
I am sorry, because I don't want to not answer this question. There's a question that this patient had VAST and had endometriosis, was not removed, and she had pleurodesis. Can she have another VAST and take care of endometriosis? Because she was told it is dangerous. And the answer is yes, she could have another VAST. As I showed you in my video, this patient had VAST and pleurodesis before. It is more difficult, but it can be done by expert. Thank you.
No, that is thank you very much, Dr. Farr Nezhat, for bringing up. That is why in our positions, when we see patients who have endometriosis of the lung or diaphragm, we don't do pleurodesis regularly, because when we see the pathology, and endometriosis is recurrent, we only remove the lesion, and doing the pleurodesis sometimes makes it more difficult to do another VATS, or thoracoscopy. So that is why we, in our presentation recommendations, when we see definite endometriosis, we excise it, we remove it, and we do. Thank you so much, Dr. Farr Nezhat, for bringing up this question. Anyway, Dr. Backhus, Dr. Ceana Nezhat, do you have any recommendations? Any of the other panel? Michelle, Jessica, Abbe, do you want to say something? Anybody has anything to say?
Michelle, you are mute.
Unmute. Okay. I just want to, let me just reemphasize this again. Every doctor I had seen prior to Dr. Nezhat said it was impossible. They even encouraged me to go for donor eggs. Please, it is worth the travel. It is worth the headache. It is worth the money to go see the best of the best. And you know, don't sit back and say, I can't have children. Well, I can honestly tell you, you can help children. These doctors are incredible. And if it can happen to me, it can happen for you.
Thank you very, very much, Michelle. You are so kind. And I tell you, I cannot get over how beautiful is Ceana. And look, contrast to it is my brother. Look, Ceana. Beautiful Ceana, and look at my brother. You cannot even look at him.
Thank you, Michelle. Thank you, everybody. But to re-emphasize what Dr. Farr Nezhat, Michelle also had polyradisis before, which shouldn't have been done. And we did, when we did her VATS and took care of the fenestration, took care of her problem. And Michelle had given me permission to share her story. So Michelle is a perfect example of a patient being her own advocate. And when they told her, oh, we did polyradisis, you shouldn't get it, she said, no, I'm going to go see Dr. Nezhat. We took care of her. So it can be done. Thank you again.
I agree. Michelle, Leah, do you have any last minute suggestions, or would you like to say anything? Dr. Backhus?
If anybody wants to call me, please give them my number. I love to help people. I want to help them. I want them to believe. So you feel free to give them my telephone number.
Thank you so much, Michelle. Thank you so much. Thank you. Ceana, I like your little costume.
she's a Finnegan fox.
Yeah, it looks beautiful.
Thank you.
So, Dr. Bacchus, do you have any last minute additions? Would you like to say anything?
No, not really. I mean, I think that the stories are the most compelling thing, that the strength of this whole webinar has been the impact of having the patients themselves describe their journeys. Everyone that I've ever encountered has had a very lengthy journey. It's not just a one and done kind of thing. And so I think it's I mean, not being an endometriosis patient, I still think that these stories are incredibly impactful. So it's really nice of you all to have availed yourself and recognize the fact that it is a journey for sure, but that if you've got the right team working for you, that there should be some light at the end of that tunnel for sure.
Thank you very much. Thank you. Dr. Azadeh Nezhat, if you are online, do you have anything to add about the patients or patient that you see with endometriosis of the diaphragm and lung?
Yeah, I just want to say, first of all, I apologize. I didn't get to introduce our wonderful patients, Abbe and Jessica. No, I think it was a fantastic webinar, and everybody is, we're so excited to see them doing a lot better than they were doing. And all of them, they've had a really tough journey, but the end result is wonderful. So we're happy they have had great results.
Thank you very much. Thank you very much. Anybody else has anything? If you don't, we again, one more time, we say goodbye and happy holidays to all of you.
Bye. Say bye.
Bye-bye.